You've heard about balancing your hormones. In fact, the concept is everywhere. As soon as you do a quick Google search about hormones, you're going to discover the phrase balancing your hormones or balance your hormones, or especially balance your hormones naturally. What does that mean? And what about some other terms like hormone replacement? And then the term that I like to use, hormone optimization. Let's talk about that. I'm Steve Goldring from SimpleHormones.com. I help patients and healthcare providers with easy to understand patient education resources, mostly about hormones and hormone optimization. But today we're talking about hormone balancing, or at least a little bit about hormone balancing, and then we'll get to some of the others later. Eating for hormone balance, essential oils for female hormone balance, workout to balance your hormones in only 15 minutes. The top 10 hormone balancing superfoods: exercise, proper diet, water, sleep, soy, black cohosh to balance hormones and reduce menopause symptoms. 15 different breakfasts that can rebalance your hormones. The recipes are available. 11 food solutions to balance your hormones, 15 herbs and spices to balance your hormones, or 6 different steps for hormonal balance, including eating clean and watching alcohol and cleansing your liver. Well, there's no end to the amount of people and blogs and doctors and websites that are dedicated to balancing your hormones. I think the principle is a basic good one. The idea is that hormones, at least when you compare two different hormones in your body, two or more, those hormones are somehow out of equilibrium. They're not really lined up in the ratio that works best for your body. And so those hormones need to be, in some sense, balanced. Now, that situation that makes me think about a couple of different hormone issues where that seems to be an appropriate way to treat a hormone imbalance by trying to balance those hormones. So, for example, a woman who is of childbearing age, let's say she's 35 and she's having some PMS issues. And maybe she has some bloating, she has some headache, she has some irritability and depression and anxiety towards the end of the month. And right before her period, she also has painful periods and a lot of cramping and a lot of difficulty right around the time of her menstrual period. Well, that could be caused by a hormonal imbalance. Sometimes what happens is the estradiol level is too high in relation to the progesterone level. Sometimes it's given the term estrogen dominance. She can make adjustments in her diet, in exercise, in sleep, in some other lifestyle factors, and that could alter the balance between estradiol, one of the primary estrogens, and progesterone. Now, I think of another situation where a woman is perimenopausal. That's the 4 to 6, maybe 8 years before menopause actually occurs, and that woman might be having irregular menstrual periods. The progesterone, the main place progesterone comes from, is a piece of tissue called the corpus luteum inside the ovary. And after ovulation, the corpus luteum releases a lot of progesterone. And if that corpus luteum is not there because ovulation did not happen, then the chances are very good that progesterone is going to be quite low that month. And so this is a situation where hormone balancing could have some effect, but that woman may not have enough progesterone around to do any balancing with. Now, another situation is a woman who is, let's say, 54 years old, and she is past menopause. And that woman, her estrogen and progesterone levels have dropped to not completely zero, but almost zero. And so she can't really balance her hormones very well. She can do some lifestyle and diet interventions that may increase her estradiol and progesterone level a little bit, but not enough to really make a difference in menopause symptoms. So I'm talking about things like hot flashes and night sweats and irritability and weight gain. Those are all caused by the loss of estradiol. Things like insomnia and the brain fog because the woman doesn't get enough sleep and depression and anxiety. Those are all caused by the loss of progesterone that comes from menopause. Now, the combination of both the loss of estradiol and the loss of progesterone can be devastating for women. I've talked to literally a couple thousand of them in my surveys and in my YouTube channel comments and in emails, and many of these women are desperate for a solution. Unfortunately, balancing those hormones in menopause is going to be almost impossible because the reality is they aren't really there, and you can't really balance what's not really there. In my experience and in the experience of a lot of the women and the providers that I've worked with, once those women get hormone replacement therapy, that's not balancing the hormones that are already there, but it's adding back hormones from an outside source. And the key is to add back hormones that are exactly the same as the hormones that woman used to make when her ovaries were functioning fully. If we add those hormones back, we can most of the time reduce or even eliminate all of those menopause symptoms, something that can't be said for any of the herbal remedies or hormone balancing types of treatments that many women have tried to rely on. And I've heard this from literally hundreds of women that they've tried black cohosh, they've tried yoga, they've tried exercise, they've tried dietary restrictions, not eating chocolate and not drinking red wine and not eating spicy foods and dressing in layers, and all of these things help a little bit, but they don't really help everyone all of the time, where hormone replacement therapy will almost certainly reduce or eliminate almost or all of the menopause symptoms that woman is experiencing. Now let's take a look at a couple of other examples where hormone balancing can have an effect. One that comes to mind is cortisol, or the stress hormone. The problem with cortisol is when we have too much, then we lie awake at night worrying about all those million things that we've got to get done, or those problems that we tend to concern ourselves with that we can't really do anything about. That's partially related to high levels of cortisol, that constantly on alert hormone. So what we want to do with cortisol is balance it out by lowering it down. And the best ways to do that, there's not really a particular drug that helps to do that, or replacing a hormone doesn't necessarily help with that. But what we need to do is get better sleep. We need to learn to do relaxation techniques. We need to learn to do meditation and maybe drink less caffeine and spend some more time in the outdoors and get plenty of exercise. And those types of things can balance our cortisol levels. I think about thyroid. There are a lot of people with thyroid issues where their thyroid gland does not make enough thyroid hormones. When you have low levels of iodine and selenium, your thyroid gland is unable to make thyroid hormones because those hormones require iodine and selenium as part of their chemical structure. So if you increase those in your diet, that can increase your thyroid's ability to make thyroid hormones, and it can clear up a thyroid issue. Now, there are a lot of situations, though, where the thyroid hormones basically aren't being made in a large enough quantity, and so you can't balance what's not there. And if the thyroid has plenty of iodine and selenium, but it's still not making thyroid, then that's a situation where you might need thyroid replacement therapy or hormone replacement with thyroid. And I have another video about T3 and T4, that there are two different types of thyroid hormones, and it might be important to replace both of those thyroids. When I think about hormone balancing, I think about men and low testosterone. I was just reading a study this morning that was actually a meta-analysis, which is basically where several studies are combined together, and kind of the data is massaged to kind of see what the overall consensus of those studies might be. And basically 6 studies looked at men and their diets versus their testosterone levels. And it became clear that men on lower fat and higher carbohydrate diets actually had lower testosterone levels than men on a higher fat, lower carbohydrate diet. Now, it's probably not possible for a man with very low testosterone to eat a higher fat diet and get enough testosterone to really make a significant difference in his muscle strength, in erectile dysfunction, in his overall feeling of fatigue and low energy. Your diet can have an impact on the level of testosterone and can impact the balance of testosterone in your system. I'm thinking of another situation where hormone balance can come in. That situation would be polycystic ovarian syndrome. I have a video all about how PCOS is a combination of two hormones that are too high and two hormones that are too low. So what we have is insulin is a little too high and testosterone is also high, but thyroid is low and progesterone ends up being low. So this is a very complex situation, which is difficult to balance out those hormones. There are some lifestyle and diet changes that can make a difference in PCOS. Something called HIIT training or high intensity interval training has quite a bit of research around it in PCOS, and it does seem to make a difference. Reducing your carbohydrate intake and having a higher fat, lower carbohydrate diet can make a difference in improving insulin sensitivity, and that can lower the amount of insulin. And when the amount of insulin is lowered, that can lower the amount of testosterone. And when insulin is lower, testosterone is lower, then the chance of ovulation happening, which solves some infertility problems, can also inadvertently lead to higher levels of progesterone. Now, at the root of a lot of PCOS problems is low thyroid, and sometimes that low thyroid requires hormone replacement therapy to add back some thyroid from the outside in order to solve that low thyroid problem. So PCOS is an area where we may have both hormone balancing and hormone replacement happening at the same time. We may need both of those strategies in order to get to optimal hormone levels. Optimal hormone levels are levels that are not too high and not too low, but they're just right. Optimal hormone levels also help patients reduce their long-term health risks. Things like osteoporosis, type 2 diabetes, heart disease, and even Alzheimer's. So there are a lot of studies that show that optimal levels of estradiol, progesterone, testosterone, and insulin all help reduce long-term health risks, especially as people move from age 50 up to age, say, 80 or 90. Those risks are greatly decreased when a patient has optimal levels of all of those hormones. So I hope that helps clear up some of the misconceptions about hormone balancing, hormone replacement therapy, and hormone optimization. If this video has been helpful at all, click the like and subscribe buttons. I'd love to have you click the little bell to get notified anytime I post a new video. Thank you so much for watching, and I'll look forward to talking to you again soon about hormones and hormone optimization.